Forget.
How long do we have?
We have. It's Saturday. I usually have a half hour during my lunch break when I do these.
We'll
So
do it. We'll get it done in a half hour.
usually a half hour is a good. I think you can't get people to listen more than a half hour.
I have now created videos that are 5 minutes long, and I my concept is you can't if you can't say it in 5 minutes, you can't say it in 25 minutes. You got to say it in shorter period of time. Okay, let's get started.
Okay. Hello and welcome to Podiatry Practice Management. My name is. I'm sorry, I always forget the name. I mess the name up. Okay. Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto and I have Dr. Neil Baum here. Welcome, Neil.
Thank you. It is very nice and an honor, to be included in this program. And I've looked at your other programs, and they're terrific. And I can hope that we do as good a job as you've done in the previous ones.
Well, the bar is raised there, so we'll get right in here. I think the key is great content and applicable things for us as podiatrists. And for those that don't know, Dr. Baum has written a couple of great books on marketing, and we're going to kind of dive deep into some of those questions. So I'd like to start out with your background story. How did you get interested in marketing? That's not too common for a doctor.
When I've been in practice over 40 years, and when I started, you were allowed to put your name in the paper and tell where you were going to practice. That was it. You are not allowed to do anything more, and anything more that you did, you would be sanctioned for. So you had to be very, very careful. And I moved from Houston, Texas to New Orleans. And I'll never forget, about 6 weeks after being in practice, I walked into my office that I was in by myself, and I saw that there were more alphabet dividers than charts. And I said to the receptionist at the time, I said, Cynthia, you've got to close the file cabinet, because patients who walk in here and see the reality of what's in that file cabinet are not going to feel a sense of that they're going to feel confident that they have selected the right place. And so I realized that I had to do something different. And I found out that in the community where I was, there were 14 urologists in my area, and there were 7 in the building, that I had to do something different in order to strike out and make myself attractive. And I found out that they had patients that would come, told to come at 10 and 2, and whoever came first signed in and got seen. And so patients could wait 45 minutes, an hour. It was very, very easy for patients to have long waits. So I said, I'm going to see patients on time.
Mm-hmm.
And I got that word out that I was able to see patients at a designated, I'd schedule them and see them in a designated time. And because I didn't have many patients, I was able to see them on time. And that launched my practice. That one particular aspect of finding something that had to do differently than everybody else, because they were good doctors, they were good urologists, but they didn't have a good process. They didn't have good patient mentality. They weren't concerned about patient satisfaction, and I recognize that to be the case. And so I developed an attitude of, I wanted to treat patients like I wanted to be treated. Would I go to get a haircut and wait 45 minutes? No. Would I go to the dentist and wait a half hour, 45 minutes every time I went to see the dentist? Absolutely not. When I would go to a financial advisor, would I wait a long period of time? Why should people have to wait to go to see the doctor. The doctor got away with it because, oh, I was in the hospital taking care of somebody who was real sick. And I had to go to the emergency room, and excuse after excuse after excuse. They got away with it. Well, time is for that mentality is over. So
Mm-hmm.
if one of the questions that I think you posed to me is, what kind of marketing idea, do you have? I'll begin where I was going to end, is treat people like you would like to be treated. I'd like to go somewhere. I'd like to have no pain when I see my podiatrist. I would like to be seen by a friendly office. I would like to be seen on time. And I would like to have timely follow up. There's so many times you hear about people put in a call for a doctor, the doctor doesn't return the call. They send a message now or an email, and the
You never
message is
hear back.
not returned. That's not rocket science. That
Mm-hmm.
doesn't cost a lot of money. It's not expensive at all. So treat people like you would like to be treated, and your cup will runneth over.
You know, Neil, I remember in your book you talked about something, and my dad recently had open heart surgery, and when he went in for the surgery, they called me in the beginning of the procedure. They called me when they opened up his chest cavity. They called me when they were closing, and they called me when they were done. And I thought of your book because you brought that up, and I went and I asked them, how was that orchestrated? Was that through the hospital's protocol or the doctor protocol? It was amazing. I was like they were annoying me, but I could text my family members. My dad's doing good every single time. I was updating him, so I thought of you because you were the first one I read about those little techniques as well.
That is very easy to do. All you have the nurse do is that you tell the nurse, when we start, get a message out. As things are proceeding nicely, get a message out. And all the nurse should say to you, doctor, would you like me to contact the family now? And she says yes, and she calls out there. And that little event like that didn't take the doctor any time, and he's not that focused and that concentrated. There are breaks in
Yep.
mentality. Listen, if he gets into something that is over his head for a minute, and he has to stench the bleeding, that's not the time to ask him, not the time to get a message to him. But there are other times, there are breaks. Surgery is a ebb and flow, and
Mm-hmm.
when there are those ebbs, that's when get the message out to the family. So easy to do, and it just makes you unique and show your empathy. That
Yeah.
shows you care. If that surgeon was having his family member operated on, he would want to know. And
Correct.
so he's doing the same thing. He must have read my book.
He must have. Another thing that I've done years for years, is I make a little thank you gift after I do surgery, and I give them. And the staff, they don't know how good of a surgeon I am, but they know about my gift that I give to all my patients. It might be a popcorn with a little thing on there, keep your feet up, or something. I think that I learned that from you too. A lot of these like simple little things you have like in your, I don't know which one, I think it was the blue one, the clinical practice, the marketing, but there was tons of chapters. Now all that content, is that, how did you learn about all that stuff? Was it you just did it and you wrote it down, or you studied other people? How does one like go about learning about this stuff? What are some tactical aspects?
uh, you can learn it from others, and I learned it from other industries.
Hmm.
Uh, when I checked into a hotel one time, I'll never forget. I went to the hotel and I checked into the hotel. They didn't have me stand at a desk and fill out information. They said, "Come over here, sit down. Can I get you a lemonade, an iced tea?" While I'm checking in, and the really good ones, know in advance who you are and your credit card information, and escort you up to your room, and then they sit down and find out what you need, want. Do you want the paper in the morning? Do you want your shoes shined? And I decided to do the same thing with my patients. I try to start the process of communicating with the patient and giving them a positive experience before they come to the office. So the receptionist will say, let's assume it's before internet. Remember, I'm been in practice 40 years, so a lot of my career was before internet. It was before internet. We are going to send you a welcome to the practice package, and in it is your demographic information, your insurance information, and a health questionnaire. You can make your visit very seen in a timely fashion if you fill out the questionnaire before you arrive. If you don't fill out the questionnaire, or if you need help filling out the information, we understand you must come 20 to 30 minutes early. So a patient who has a 2 o'clock appointment, they come on time at 5:02. They haven't filled out anything. They have 20 minutes of paperwork to do. They're not going to get seen to 2:20 or 2:30. They have now wreaked havoc with your schedule.
Yeah.
I also wanted to educate them regarding what to expect on the first visit. One of the things that in a urology office is you will be asked to give a urine specimen when you arrive. Please consume plenty of fluid so you're able to do it, because when they arrive, they're nervous. And what happens when you're nervous? You go to the bathroom. You go to the bathroom before you get there. So consequently, that can throw your schedule off. So these are little fine tuning things that you can do easily. That I like to emphasize that marketing is not necessarily expensive. It doesn't require a lot of outlay of money. The things I've described to you so far, aren't expensive at all. And yet it makes the patient visit very efficient and solves one of those problems we have pain points in our practice. Problems with staff, problems with insurance, problems with prior authorization, malpractice insurance, hiring and firing. I have about 20 pain points. What can you do to alleviate those pain points so you are enjoying what you're doing? And the doctor should enjoy his or her practice of medicine, and not should be that they wake up in the morning and say, oh, gotta go to work today. I wake up, I was excited to get in there. And I was just as excited to get into the office as I was to get into the operating room.
That's great. I know one of the pain points I think I learned from one of your books is when patients came in for a condition, I really got tired. Right? I get tired of explaining plantar fasciitis over and over and over. I explain it every single day. And what I learned from one of your books is you said, well, why don't you put a little presentation together? And so that's the first thing I took, and I did one on plantar fasciitis, and it's a series of a few slides, but it makes it more fun to do it. I just pull up the slideshow on my little computer and I show it to them. But for them, it don't skip any steps, because I usually, when I have plantar fasciitis, like if I had 5 minutes, I give them the 5-minute explanation. If I had 20 minutes, I give them the 20-minute. But with the presentation that you talked about, they got the same presentation, and I could record it as a video later on and things like that. So how did you get to that idea of doing presentations for your patients or things like that?
As a urologist, I would do 3 to 5 vasectomies on a Friday. It was very popular amongst young men to have their vasectomy. Did you have it on a Friday?
I had it on a Friday, and this guy that did it for me, he used to be a magician like I was, and he was like, we were talking magic the whole time, and it was great.
Who is the urologist?
Oh, I'll figure it out here. I'll let you know in a second here.
All right. So 3 to 5 vasectomies on a Friday afternoon. Almost all urologists do that. I wasn't special. I wasn't, there's not a lot of talent involved in doing a vasectomy. And I saw myself, like you said, with plantar fasciitis. I kept saying over and over again, you're not sterile right afterwards. You got to go home, put the ice on. have to lay down. You have to
Mm-hmm.
have no intimacy for 5 to 7 days. And I can say, so I said, why don't I make a video? And
Mm-hmm.
so I made a 5-minute video, and I would show it to them when I knew what they were coming in for. I would introduce myself to them, and then I said, "I'd like you to watch this video, and I'll be back." I went and saw another patient or did a procedure, and then came back, and then they took a little true false um, uh,
Quiz.
quiz on that they understood the video.
Ah, I like the
And
quiz
then that
part.
goes into the chart, and it was in Spanish and in English. I don't know how many Hispanic people you have, but we have a lot in New Orleans, and
Mm-hmm.
they're wonderful patients. But I wanted to be sure that they understood the video, and so they took a not with me there. Right at the assistant gives them the you watch put on the video, gave them the questionnaire, watched the video, and every video ends with, I know you may have some additional questions regarding A, B, C, or D, and I'd like you to open the door when you are completed the video, and I will be into the room shortly to answer any additional questions you have. So uh, that, and it's a video of me, not a pharmaceutical company, not a device company. It's me. And it was the same discussion I was having anyhow. So why not say it once? And it wasn't professionally done. There's no music in the background. There's ahs and it's not professionally done, but it worked,
Yeah.
and it was documented in the chart. Patients saw the video on alternatives to treating whatever it may be. So it's a very effective method of education. And now the receptionist says, asks, what are you coming in for? Finds out what the uh, chief complaint is that the patient has, and tells them that please go to YouTube or to the website, and there will be a video related to your topic, and Dr. Baum would like you to watch it before you come in. So I'm setting the stage when they call for the appointment that they're going to have a unique and different experience.
Wow. I remembered his name, Dr. Michael Woolen. He's
Oh,
in Worcester. He says
yeah.
he does more than anyone else. So when I had my vasectomy, he went through the whole thing, and I was thinking, man, he must explain this many, many times. And I like the video. I haven't tried the video. I've done a presentation, but I really like the idea of. I think even this day you can because our desktops they lock because of HIPAA, but I think we could just use a simple iPad or something like that. Give them an iPad and we'll have them watch it.
Oh, it was towards it was also on my um, what's it called? It was on my electronic medical record. They had it on that screen. She could pause the EMR in the office. It was a pullout from the wall,
Mm-hmm.
the computer, and she could load the video. There are 100 videos that I did. I did one per month, one a month, and I paced myself, and I have it on everything, and it was very easy to do. And then they showed it in the office.
I think people could take one thing away if you did that, because we're all making content, but using it in front of the patient. I a lot of times find I give it to them after the fact, but they don't always use it. Like you don't know, they're not a captive audience. After they leave your office, they're not as captive. So I really like this. That's great. We talked a little bit about in terms of how do busy doctors make time for these things. In terms of, do you have to do everything, Dr. Baum, yourself, or can you use a virtual assistant or someone else to do some of these things to save you time?
I only do what can only be done by the doctor. Doctor can only diagnose and treat disease. Everything else should be delegated. I don't do any of these other things. I get it started and I implement. And let's say we're going to talk about same day appointments or whatever it may be. I implement, but then I don't do anything. I don't research the fax machine. I don't research a vendor. I'd have somebody else do that and come and summarize it to me. The doctor should work at the top of his license, and the license is to diagnose and treat disease. The nurse can't do that, receptionist can't do it, the billing can't do that. Nobody else can do what the doctor does. And the doctor should only do that. And everything else should be delegated.
That's perfect. That's perfect. Let's delve a little bit more into. I know we have a few minutes left here. We can delve into some other. We've talked about kind of surgery. We've talked about the presentations. What are some of the other? There's the 80-20 rule. Okay, so what are the 20% of things that you're finding that doctors can really easily implement and get the greatest impact for their marketing?
Okay. Uh, to find out what the patient wants and give him or her more of it, find out what the patient doesn't want and avoid it. And it's easy to do a survey and find out what they want. You know, do they want a reception area that offers coffee? Probably not. You know, that's probably not. Now, as a urologist, I wanted them to be able to give a urine specimen. I did have a fountain, not a fountain, but a water distribution,
Dispenser.
Yeah. So, but that wouldn't apply. But find out what the patient wants. Yeah. So they want access. They want to be seen when they call for an appointment. They don't want to wait 2 or more weeks to be seen. If you have them waiting more than 2 or more weeks, they're going to find another doctor. In other words, if they've got plantar fasciitis and their foot hurts and their foot is throbbing at night when they lay down, and they've tried the Coke bottle treatment or all the
rolling and things like that. Yep.
But yeah, and they've tried all that and they're hurting, they would like to be seen in 2 or 3 days. And so the faster you can accommodate them, and that means I always left slots open late morning, mid-afternoon for emergencies and urgencies to be accommodated by getting patients in immediately. And I kept a wait list, and patients who said that they would be able to come on short notice. And if we had a no-show, we would call that. We had the schedule filled, and there was no Swiss cheese holes looking in my schedule. So give patients what they want, that they want access. I talked a little bit about timely follow-up. Don't leave records unfinished in your EMR or on your desk. Those have to be completed. Ideally, you should make time while you're with the patient
in
at
the
the point
room
of service, completing the record in front of the patient. So if there's any discrepancies, it's done right away, because you won't remember on Friday what you did on Wednesday at the same level of accuracy. So do timely follow-up. And the real bottom line is to exceed their expectations. One of the simplest things I did, I had to drive home from work every day, 10 minutes from office to home. And that was a time that I called what I designated as my key patients who were had a procedure that day in the ambulatory treatment center, 1-day surgery. And I did a lot of that. And podiatrists, I think, do a lot of 1-day surgery. So when they're kind of waking up from the anesthetic or the pre-op medicine, they don't remember what you're saying. They have questions. The patient discharged from the hospital, the new patient that you maybe a little older, maybe a little cognitively impaired, call them on the way home
Hmm.
and ask them how they're doing. You could, if you've done it, you can almost hear the phone drop with a thud. My doctor called me
Yeah,
at home. What?
they're not used to that at all.
No. So, that's you're exceeding their expectations. Make them feel that you really care and are concerned about them, and do these little extra things. I haven't once talked about a logo, a brochure, a paid ad, on the radio or in the newspaper. You don't start there. You don't even have to go there. Everything that we've talked about in the last 26 minutes have been something that every podiatrist can do. I would like to call to your attention to your viewers
Thank you.
in podiatry management, and I contribute to this publication, but I also uh, read it pretty much cover to cover. I think it is really well done. And I'd like to call to the attention in the recent April-May issue is a article by Timothy Bowden, and it's called Common Sense Marketing and Driving Referrals. It's excellent. And I would recommend to anyone who is watching this program that they take time to look at Barry Block's
Yeah, great publication.
management.
Well, that's great. We've covered a lot of things here, Dr. Baum. I appreciate your time and your longevity in terms of this interest in marketing. If people want to learn more about you, about these books, is there a good place they can go, a website, or can they just Google your name? What's the best way to learn
Yeah,
more?
they go to Amazon and type in my name, and they can see the latest marketing books that are available. They're available on Amazon. And I would recommend just watching this video again, the
Yep.
video that we have done. I don't think it's necessary to go there in the beginning. Just think, how can I make the patient experience in my practice positive? And how can I create a unique experience for my patient? And if you answer that question, I can assure you that you won't need to. I'm honored that people would like to read the book, and my wife will be honored that we get more royalties. But you don't need to do that. You need to think about your patient and giving them a positive experience. Start just by seeing them on
On
time.
time.
Just start there, and
Yeah.
you will be amazed at how your practice will flourish and grow, and you will be a happier podiatrist.
Great. Well, thank you so much for your time. I appreciate it.
Don't hang.
I'm not. We're
Close
still
it.
on. We're still recording.
No,
Okay.
stop the recording.